Today we're going to be demonstrating placement of an intravenous catheter, also known as an IV catheter. This is a skill that you will do throughout your career on a daily basis. As you learn to place IV catheters, you will develop your own method for placing them. The one thing that has to stay consistent is asepsis, security, and observation. There are many different types of catheters that you can use when placing an IV catheter. We have a few different options here. Here is a butterfly catheter. This you will most commonly see for use of blood collection. This one here is a central catheter, which is most commonly used for jugular catheters. What the difference with this one is that it's placed into the jugular vein and it's called a through the needle. So this needle will go into the jugular vein and then the catheter is placed coming from within the needle. These catheters are also in some practices used for central lines for multiple patients that need multiple blood collections. Other options for IV catheters are ones that are over the needle, such as this, where it slides over the needle. So the catheter is actually coming off the stylet as opposed to within the stylet. With the over the needle catheters, we have different options for sizes. We have here 24 gauge all the way through to 18 gauge. Please note that there are different lengths. So depending on the size of your patient, the location that you're placing the catheter, you may need a specific size or a specific length. So it's important to pay close attention to that. Some of the areas that you can place your IV catheters will be cephalic veins, saphenous veins, so medial saphenous, lateral saphenous. Those three are going to be the most common. Other options are jugular veins, dorsal pedal veins, and sometimes even carpal veins. Those typically are ones that are a little bit less common, but you may see them in the future. What we have here is our setup to place an IV catheter in our patient. So it's important to be prepared before we start. So here you can see we have a set of clippers. We have our scrub. So we have chlorhexidine scrub and isopropyl alcohol. We also have rolls of tape of 2 different sizes to help secure our IV catheter. I have actually got some pre-drawn up for my patient. So I have 1/2 inch tape here, and if you'll note, I have it tabbed on both ends for easy removal. And then I have a second piece here of 1 inch tape with the same thing, tabs on either end. We also have a PRN cap that will go on the end of our IV catheter once it is placed into our patient. And we have a pre-drawn up syringe of sterile sodium chloride. We also have, just in case, to be prepared, a tourniquet in case we need extra help if our patient isn't cooperative or if they have not uncooperative vessels. And we also have cohesive bandage here for protection once our catheter is placed. Okay, now we're going to get ready to place our IV catheter into our patient. This limb is a front limb, so we are going to be putting it in a cephalic vein. The first thing I'm going to do is grab my IV catheter. I have a 22 gauge times 1 inch catheter for my patient. What I'm going to do is I'm going to get it ready ahead of time. So I'm going to twist this covering case, and I'm going to take the lid off, meanwhile keeping everything sterile. What you would like to do is wiggle the hub at the end of the catheter because sometimes it can become very stuck in there. So you just want to give it a loose twist and then gently place it back in there. So when you do get the catheter into the vein in your patient, it is easy to remove. You do not want to move the catheter off of the stylet because this can actually cause burring or flare. So the end of the catheter can actually flare out, and this will make it more difficult for you to advance your catheter in your patient's vein, and also can make it a little bit painful. So you do not want to loosen or advance this end of the catheter. Now that I have that ready to go, I'm going to sterilely put that back in the container so it's ready to go. And I'm going to ask my restrainer to hold off the vein. Thank you. I'm going to see if I can palpate where the vein is, locate it. I can feel it right here. I'm going to get my clippers and clip the area. Note for this video, I will not be clipping all the hair off our patient. So I'm going to go over it on the central area on one side and then on the other side. Move any hair away. I now am going to scrub with my chlorhexidine and alcohol scrub. Note that I'm always holding on to the distal end of my patient's limb, so that way I always have control over my patient. So I'm going to scrub 3 times with the chlorhexidine scrub. Now I'm going to take my alcohol and I'm just going to wipe it. No scrubbing. Now in a live patient, this would have no fur over my insertion site. All right, so I have my restrainer holding off my vessel. I am holding on to the limb of my patient. I am going to now sterilely take my catheter out of the case. I have my bevel up, and I'm going to go on a little bit of an angle and insert my needle into the vein. See how I have a flash of blood going into my catheter? This is how I know that I'm in the right area. Now what I'm going to do is I'm going to advance the catheter off of the stylet. Note that I advanced the catheter off of the stylet. I did not move the stylet. I will now ask my restrainer to stop occluding. I will ask them to put their thumb over top of the catheter, but not on top of the insertion site. I will pull my catheter out, my stylet, sorry, out, and I will place the hub back into the catheter. Note that I have my thumb on the end of the catheter, so if my patient moves, I can move with it and still have control of the limb and the catheter. I now am going to lift up just a little bit on the end of my hub. I'm going to place my 1/2-inch tape underneath, and I'm going to make a butterfly tab. So I have folded it so the sticky part is back on top of itself, and I have not taped over any of the connections, so I'm still able to remove this hub of the catheter when I need to. I'm going to lift my patient's limb up just a little bit so I can reach underneath. No, I'm still holding on with my right hand, and I'm going to put the rest of the tape around. So I have my butterfly here is going to help anchor and secure my catheter in place so it doesn't slide out. Again, I'm now going to stick my other tape underneath the catheter, underneath the blue part of the catheter there. And notice how I'm still holding on to the end, and I'm still holding on to the limb of my patient. And I've pushed the tape up underneath as far as I can to help anchor it. And I'm going to, again, not tape over any of the connections. And you want to tape it so it's secure, but it's not too loose, but it's also not too tight. Okay. Now what I need to do is grab my PRN cap and I will ask my restrainer to again put their thumb over top the end of the catheter, and for this I will have to let go of my patient's limb, and I will hold with my 2 fingers, hold the base of my catheter to prevent it from not pulling out. I'm going to give the hub a gentle twist, keep everything sterile, and put that PRN cap on and twist it into place. My holder can now go back to holding behind the elbow, and I have a good grip on my patient. I now will get my sterile sodium chloride, and I will flush my catheter, making sure I don't have resistance. Now I know that my catheter is in place and it is patent, which means that it is in the vessel and working properly. Now I can get my cohesive bandage, because as you can see, I have a little bit of blood here from my catheter. I can always get some peroxide, clean that up. We want our patient to be nice and clean. And I can place that cohesive bandage over the tape to protect the catheter. Now, earlier I discussed how when we advanced the catheter into the vessel, how we did not advance the stylet. We kept the stylet in place and we only advanced the catheter. So we kept it in place and advanced the catheter off of the stylet. This is because we want to prevent spearing. Spearing is when you have the catheter partway into your patient's vein, and then the stylet is re-advanced into the catheter while it's still partially in the patient's vessel, and what happens is it can look like this. And so it actually slices through the catheter and can do damage to not only the catheter but to the patient's vessel. So it's very important that when you first hit the vein with your catheter and stylet together, that once you advance your catheter, you are keeping your stylet in place and just advancing the catheter. So now we're going to discuss IV catheter care and potential complications that can come with placing an IV catheter. When your patient has an IV catheter in place, it needs to be observed several times throughout the day to make sure that they are not having any potential complications that we'll discuss in a few minutes. Some things that you want to look for are going to be the patient bothering at their IV catheter site. So are they licking, chewing at it? Do they seem painful? Are they now limping on the limb where they previously were not? Those might be signs that are going to indicate to us that there's something going on. You also want to make sure that you're checking the bandage to make sure that it is clean and dry, that it doesn't have any IV fluids that are leaking or have been disconnected and leaking. You want to make sure that the patient hasn't soiled themselves and got urine or feces on their IV catheter bandage. IV catheter care should be done, complete IV catheter care should be done at least once every 24 hours unless something is indicating to you that it needs to be done sooner. So this includes stripping back the tape so you can visualize the catheter insertion site and check for any potential complications or reasons that would indicate that we need to either replace the IV catheter or remove the IV catheter. If your patient is not on IV fluids, then what you have to make sure you do is that the catheter is flushed with sterile saline once every 4 hours to ensure that the catheter stays patent. Some of the complications that can arise from IV catheter placement are going to be phlebitis, thrombosis, extravascular fluids, hemorrhage or hematoma, or infection. So to quickly go over those, phlebitis is going to be inflammation of the vein. So that's going to be shown to you by erythema, swelling, tenderness when you're touching it, those sorts of things. The patient, like we said earlier, if they're limping on their leg, it may show that they're a little bit sore. Thrombosis is going to be a formation of a clot within the inside of the blood vessel. The vein may also appear raised when it's being occluded, and you wouldn't be able to flush with your sodium chloride. The next is going to be extravascular fluids. This is going to be where the catheter has been dislodged and it has now gone through the vessel, and the fluids that are going into your patient are now going into the extravascular space and the surrounding tissues. Hemorrhage is going to be if your patient disconnects from their PRN cap or their IV fluids and now the blood is flowing out of their catheter. We need to be very aware that that doesn't happen and that we have securely locked the fluids or the PRN into place. Infection is going to be very similar to phlebitis, so signs of infection are going to be similar to phlebitis. They're going to be, you may see erythema, swelling, tenderness, as well as you may see purulent discharge as well. Okay, now we're going to be demonstrating removing an IV catheter. First thing I'm going to do is I'm going to ask my restrainer to hold the limb so that way we have good control of our patient. Note that she's not holding off the vein, she is just holding behind the elbow so my patient can't pull their leg back. If my patient is cooperative, I can undo the cohesive bandage. Now, the one important thing to think about is when we are removing the tape, we want to always remove it off to the side or closer to underneath. We do not want to be putting the scissors in any direction like this, on an angle, or across where the catheter is. You want to keep it parallel to the limb. If you have it on an angle, you're getting close to being possibly cutting the IV catheter, which could then give you a catheter thrombus, which means that the end of the catheter would be within the patient's vein. So what I'm going to do is I have my bandage scissors. I'm going to place the bottom of the scissors, bottom blade underneath. So I'm going to, it has that little ledge there so I can slide it underneath the tape. And I always just lift it up to make sure that I can see the blade of the scissors underneath the tape so I don't have a fold of skin or anything caught in there. I'm going to cut it. I'm going to loosen the tape. And now what I'm going to do is I'm going to get my cohesive bandage and gauze, and I'm going to pull back on the tape and I can see where my catheter is there, I'm going to place my gauze over top and pull out the catheter. I'm going to inspect my catheter to make sure, because I know that I put a 22 gauge times 1 inch catheter in there, that when I remove it, I have the same length. So I know that we have not left a piece behind. Then I'm going to gently wrap the cohesive bandage around. Note that I have my thumb here so as to not put it on too tightly to prevent, so I don't prevent circulation. I have a little tab, and then I will remove my thumb, and we will leave our IV catheter bandage on for about 15 to 20 minutes. Best thing to do is to set a timer so you do not forget. You do not want the catheter bandage to be on too long, as it can prevent circulation to the distal part of the limb. You also want to make sure that if you are sending the patient home, that you remove this bandage before sending them home with the client. Today we are going to be demonstrating how to sterilely set up IV fluids for our patients. This is something that you're going to be doing on a regular basis throughout your career as a technician. Before I get started, I always want to make sure that I'm prepared and that I have all the supplies that I need. So you can see here that we have different size bags of IV fluids and also different types of IV fluids. It's very important to check with the doctor to see what fluid type they would like to use for our patient's particular condition, as well as choosing the correct size for the fluid rate that we have calculated. Here we have a lactated ringers that I will use for demonstration. We also have an extension set here, which would connect to, this end would connect to the hub of our catheter in our patient, and this end would connect to the end of our IV line. And we would prime this, meaning we would fill it with sodium chloride as to prevent no air from getting into our patient. I also have here 2 different examples of drip sets. So we have here a 60 drop per mil drip set and a 10 drop per mil drip set. Again, very important to be prepared and know what rate our patient's going to be on in comparison to their size. I can rip it open, and if you look here at the chamber, this is the 60 drop per mil, so you get more drops per mil. You can see that the chamber has a little pin coming out of the hole there, and that's where those little drips, those 60 drops per mil, are going to come out. In comparison, we have the 10 drop per mil drip set. And you can see here how within the chamber, there's no pin. There's just that bigger hole. Okay, and so that's where the larger drips are going to come out to give us 10 drops per 1 mil. What I'm going to do first is I'm going to open up my fluid bag. And you can see here that we have 2 ends to our fluid bag. We have an injection port if we needed to add medication to our fluid bag. And then we have the port where we're going to insert our drip set. It's very important that we keep both ends sterile. What I'm going to do is I'm going to, for demonstration purposes, use this 10 drop per mil drip set. You can see that it has the end of it, so the spike, which has a sterile cover over top of it. We have our chamber, and I'll show you when I hook it up to the IV fluids. There's a line on here, and this line indicates the maximum fill line for the IV fluids. We have our IV line. We have 2 clamps here, so that will allow us to turn the fluids on and off. So this one slides across, closes it, opens it back up. And this one is the roller clamp, and this is the one that we use to adjust how many drips per minute our patient gets. And it rolls up and down, down and up. Okay, so when it's fully open, I can slide it. And then we have a couple injection ports in case we need to flush our line or give any medications to our patient. And we have the end of our drip set, which has a lure lock to attach to our extension, which we mentioned earlier, so it would attach right there. And it has a sterile cover on it, which we will leave on it until we're ready to connect our fluids to our patient. So what we're going to do is we're going to hold our fluid bag up, and I'm going to remove the protective case. So I'm keeping this sterile. I am now going to remove the protective case on my spike, keeping everything sterile. I'm going to insert the spike, and note that I'm pushing, giving a gentle twist as I get it into the, oops, I clamp that. So now we have that into the bag. I'm going to turn that up. And you can see here that it's actually overfilled because I left the clamp open, which what you should do before you connect it is actually close the clamp so you don't fill the line. So I've closed this one down here. Okay, so because I have overfilled it, this is a good demonstration to show you how to fix that. We can turn that upside down, and you can actually gently squeeze the chamber to put some of that fluid back into the bag until we have it at the line. Let me take a second here. There we go. Just above, it's just above it. You want it to go just below there. So now what I'm going to do is I'm going to bring this over to my IV fluid pump, and this is a Flow Guard fluid pump. I'm going to hang the fluids. There's a little hole here that sometimes you have to open right there so you can hang the fluids. And now what I'm going to do is I'm going to prime the line. So that means I'm going to fill the entire IV line filled with the IV fluids. It's very important that when you hook up your IV fluids and you're going to put them onto your pump, that you do it from start to finish. It's very easy to get distracted when you're in practice and you don't want to have it set up halfway and leave this filled with air, because that could cause an air embolus in your patient and it could kill them. So what we're going to do now is I'm going to unclamp my clamp at the end here, and I'm going to leave this end of the line, the cap on, so it stays sterile, and I'm going to let the fluids drip all the way through. And I want to make sure that I have no air bubbles throughout my line, which I do not see any. So I'm now going to clamp that. Okay, so that's clamped off. And now I can set up my fluid pump. So here we have a Flow Guard, and depending on the fluid pump that you have, certain IV fluid pumps do require special drip lines. So it is important to be familiar with the IV fluid pumps and the drip sets that are required for the pumps within your practice. It's very common to have different pumps in your practice depending on where you've purchased them from. Here you can see we have this Flow Guard, and then we have a Vet Pro there, and we will demonstrate both of those. Lucky for us here at the college, we can use these drip sets for both IV fluid pumps. So when you are going to set up your fluids, you want to make sure that you have, what I do is I move one of the clamps up above, and then you can, so that way it's above where it's going to be in the pump, and then the other one's lower down for easy access. And for here you can see, so if this looks like this, you hit push to open it up, and then this door opens, and then you can see that there's an area for the tubing. What you're going to do is you're going to place the tubing within, and it says press tubing into guide slot from bottom to top. So we're going to make sure that we're putting it in. So here you can see that I have to open the safety clamp to get it in there. And we want to push it up and around that little curve. And then once we have it in there and we know that it's secure in the safety clamp and we have everything coming out this way, we can close the door and lock it into place. Now that it's on our fluid pump, we can get it ready and set it up for our patient's calculated rate. What I'll need to do before I give it, so I'll hook it up to my patient sterilely, and then I will unclamp my fluids, because otherwise it will be occluded and the pump will not be able to pump the fluids to our patient. Now for this one, to turn it on, we hit on. And to set the rate, we hit primary rate. So we want 100 mils an hour. Volume to be infused, the volume that we would like to give to our patient. Say we want them to get it for an hour, so 100 mils. And then we hit primary start. And the pump will automatically start to give our patient their fluids. Hit stop, off. Now, if I was to take this off and disconnect my patient from fluids and I wanted to take the bag off, you want to make sure that you clamp the line again, open it up, push the safety clamp so it's loose, and then you can take that out and discard it as needed. Now for our next IV pump, so this is our Vet Pro 2000. We're going to do the same thing here. So we're going to hang our bag. We have ensured that we have properly primed our line. If we're not sure, we'll unclamp it and let the fluids run through a little bit just to be on the safe side. You can see here actually that there's an air bubble. So I want to make sure that we get rid of that. So we do not want to administer that to our patient. Okay, I'm going to clamp that off. This one here, you can see the little notch at the side. You want to pull that down, and then you can pull this out, and you can see that it tells you the flow direction of the tubing. So as it's coming out of the tubing, you want it to be going in the same direction, otherwise it will not administer the fluids correctly to your patient. So I know that this is the end of my fluids going to my patient, so I'm going to take my fluids, start from left to right. Similar to the one we did, you can see how it has a little tunnel that it sits in. And then once it's in there, I just push this closed, and it's set to go. Again, I'm going to unclamp my fluids so they're safe to run to go to my patient. I can turn this on. It'll do a little self-test, and then it will ask us to set the information to set the rate. So press OK for volume, so the volume to be infused to our patient. 100. Okay. And we want to change the rate. So I hit stop, rate. I'm going to change that to the rate we would like. ask me again for volume. We know that we've already set that, so that's okay. Press the OK key, and then it tells you press OK to start. So I press OK, and it will start running, and it will run until it has given 100 mils to our patient. Let's pretend that that's complete, and we can disconnect from our patient. We'll hit stop, and then for this machine, you hold down the off button, wait for it to beep. I'm going to clamp the end of my extension or my line again, so that way the fluids don't run out onto the floor. See? And then I'm going to pull this little notch down, pull this out, and pull out my IV tubing. And that is how you set up the IV fluid pumps here at Douglas College.